Imagine if today was the day your idea changed someone's life. Imagine if you could help someone pay for college, help your community build a new playground, or help a child make it to that dream competition. With GoFundMe, it's all possible. GoFundMe is the world's #1 fundraising platform trusted by over 190 million people. Every week, ordinary people meet their goals and do extraordinary things. Your ideas matter. GoFundMe isn't just for emergencies. Want to raise money for your kid's soccer team or raise funds for a small business, a creative project, or event? GoFundMe helps you turn ideas into reality. And help adds up. Fundraisers you start for someone else raise up to 5 times more. So think right now, who could use your help? Change rarely comes from waiting. It comes from someone deciding, today I'll start. Don't wait for someone else to bring change. Today, start your fundraiser in just minutes at GoFundMe.com. That's GoFundMe.com to start your fundraiser. GoFundMe.com. This is a commercial message brought to you by GoFundMe.
Well, hello and welcome to the Wednesday edition of the Todd Veinotte Show. I'm Dan Alstrand. Vanessa was dancing again, made me laugh. Hope you're having a fantastic day on there. And Shelly Summers was in there dancing too, so it was like a Wednesday dance party, midweek dance party in the control room before we came on the air today. Anyway, back to the business at hand. Rain on the way in the forecast, but not until tomorrow evening. And that's good news is that we're going to see a significant, well, I guess significant is a relative term. We're going to see some rain, up to 20 millimeters, according to Alistair Alders. So we know that those restrictions continue. I know that Halifax Water released some data yesterday saying that they're seeing some improvement down there at Lake Major. But the last bit of information I could find this morning was that those restrictions remain in effect and likely are to remain so for some time. But the more water that we add to it, right, the quicker those restrictions can come off. And I know, and it's difficult for those that are on Lake Major. That's in places like Dartmouth and Cole Harbour and up to Burnside and over to Eastern Passage and up as far as Cherrybrook and into the Prestons. And I know it's difficult. And I know it's a bit of a pain in the neck to do this kind of thing. But it looks like we're starting to have an impact, and it looks like there are some days of rain in the forecast, so hopefully we can get off those restrictions very quickly. Well, the Toronto Blue Jays, oh my goodness. I was worried about this, and I think we talked about it the other day. The big relief when the Blue Jays clinched that playoff, and then they had the locker room celebration. But, I mean, they've lost now 5 of 6, right? The Yankees are just a single game back. And the Yankees won last night, so that magic number is still at 4, as far as I can tell. And it's getting to be scary. Like, we know they're going to make the playoffs, right? That much we know. I would much rather win the East as a Blue Jays fan, and because we have a strong record, maybe have a little bit of a break during the wild card. Wild card games scare me. It's a 3-game shootout. The good news on that end of things is that the Toronto Blue Jays would be the home team because I think they own all the tiebreakers. So let's hope that they can right this situation. The potent offense that we've seen, that clutch hitting that we've seen in the past, those come from behind wins in the 7th and 8th and 9th innings, haven't happened in the last week. And I know that they're missing Bo Bichette in the lineup, who was one of their clutch hitters, who's out injured. But let's hope that the Jays can right the ship. This isn't the time to be on a losing streak. You want to be peaking at playoff time, not regressing. And you think I would have learned last time when I let my phone go that it shouldn't ring when I'm on the air. But I'd fixed it, and it won't happen again. It's twice, 2 days in a row. Vanessa's going to have my hide soon. Anyway, lots of news going on out there. Holy smokes. Yesterday, Regional Council had its meeting, and Dartmouth Cove was at the top of the agenda. And council had a debate on it last night, watched it. And at the end of the day, they went with the recommendation that was brought forward by Councillor Sam Austin to defeat a staff recommendation to defer. and then to move forward, I think, first reading with the new bylaw that would afford Dartmouth Cove on the Halifax Harbor the same protections that we have seen instituted in the Northwest Arm. That is going to go again through the process, and there's not a lot of more information on it other than people that are impacted by it are not happy with the decision yesterday because one of them, in fact, one of the property owners sent me an email with a statement. And it reads this: the following media statement is from owners of a Dartmouth Cove property that was the subject of an HRM council meeting today. Council chose to advance a new bylaw limiting infilling on the property. It reads, once again, HRM Council has acted where it has no jurisdiction. Infill permitting for Halifax Harbor is under the authority of two federal departments, Department of Fisheries and Oceans and Transport Canada. Despite being repeatedly advised by HRM's professional staff that infilling authorization was not in HRM's jurisdiction, Council chose to create a new bylaw, or begin to create a new bylaw, I will say, in the working Halifax Harbor where it has no authority. The property owners are disappointed in Council's decision. It should send a chill to all private property owners in HRM that Council believes it can create bylaws effectively take private land from its owner and rezone it solely for public users. It ends by saying this: we will consider our options to manage and protect our property moving forward. There was a lengthy pause during the debate yesterday at Council where the Council had asked some advice of the city solicitor, and they went in camera, so we don't know what was said there. One can only assume that based on this statement from one of the property owners that there have been some sort of threats of perhaps legal action associated with this. That's just speculation. But the bylaw is moving forward through first reading and will work its way through the legislative process to stop the infilling there and to, as Council would say, to protect the Dartmouth Cove waterfront. That's happening at Council yesterday. I'm sure it's something you're going to want to talk about when we open up the telephone lines. That's going to happen after 11 o'clock today, or after 12 o'clock today, my mistake, because, of course, 11 o'clock today, Dr. John Gillis will be joining us to discuss, of course, medical news, because he's going to be here to offer you some medical advice, because it is time for house calls on Wednesday, and we'll do that just after 11 o'clock. Another small tidbit that I picked up on Council last night, and I will share it with you now. Council approved a debenture yesterday. Debentures are I'm learning more about governments and debt in the last week, am I not? Debentures are the way that the city borrows money, right? The city will borrow as they said yesterday, from the province at a lower interest rate than they would get from a bank, and then they borrow this against big projects, right? The council yesterday got an update on their debt financing from the CFO of the city during the meeting, and the numbers kind of blew me away. And this is directly from the presentation that council saw last night. It says, with the approval of the 2025-26 capital budget, council approved the following debt as a funding source: 2026-27, $215 million; 27-28, $308 million; 28-29, $396 million; and 29-30, $455 million in debt. The total debt in that 4-year plan, $1.4 billion. Now, the CFO described these debentures as a mortgage. I know one of the councillors, Councillor Cleary, took exception to that description, saying it was apples and oranges, but the way that the CFO described it yesterday was that this is a mortgage. They borrow money against big projects, and one of the projects that they used as an example of this borrowing yesterday was the Cogswell Exchange and the redevelopment there, although there's a couple of caveats with that, because there's some property that they're going to sell off to help pay off that debt. So that's what this money is used for. They also passed a TBR, and for those of you who want to know what a TBR is, that is essentially it's like the CFO described it as the pre-approval stage. So you can, when you go get a mortgage, you go to the bank, you lay out all your finances, and they say, okay, you can borrow this much against for a house, right? That's kind of how a pre-approval. It's obviously very basic in Dan basic math, but that's the way that it was described during the meeting last night. And they approved a TBR, the debt component of their in-flight capital projects, at $420 million for the next 3 years. Now, when it comes to debt, of course, we talked about this yesterday on the provincial level. There's debt servicing costs attached to this, right? And that $45 million debenture that they approved yesterday, the debt servicing costs estimated at $17.8 million. And the debt servicing cost on the TBR at current rates estimated to be at $160 million. So those numbers were kind of staggering to me. I know that sometimes numbers can be, there's context that are attached to them, and then this is likely the way that we've done business in the city for a long time. The councillors did in the discussion yesterday say that they worked very hard to lower their debt load over the last few years, but that is coming to an end now, and they will have to borrow more to finance some of these projects. The interesting part, and I know I'm talking a lot, but the interesting part of this is that this debt plan, this TBR as it's called, which is the pre-approval, right? It's a temporary borrowing resolution is what the TBR stands for. Anyway, this pre-approval doesn't include some pretty significant projects that are coming up, right? It says it doesn't include Mill Cove, the development there. It doesn't include the Burnside transportation area. It doesn't include any renovations that are upcoming to the Forum, and it doesn't include the debt associated with the bus rapid transit system. So those are in addition to. And the last little bit before I'll move on and I'll shut up is they let give us a bit of a sneak peek at what council is looking at for a budget this year. They approved a plan last night to for a schedule of when meetings are going to happen and sort of benchmarks and milestones and those kind of things. But they did say during the meeting yesterday that council is looking at about a 10% increase in expenditure this year. Just to put it into context, last year was just over 7%. And if you remember all of the debate and hand-wringing and pencil sharpening and everything else that went on when we were talking about a significant tax rate increase, which council managed to find and whittle down to a flat rate, and I know your taxes still went up because of your assessment, but the tax rate was flat last year. Now they've got an extra 3%-ish more that they're going to have to deal with this year. So I think that's setting the table for a discussion about perhaps a significant increase in tax this year, at least at this point. We know that the tax and the budget deliberations are long and take a long time, and they usually bring that number down a bit. But that was the number that got kicked around yesterday at council. We're going to stop. We're going to take our very first break here on the program. We have a busy show planned for you today. When we come back, we're going to dig a little bit into affordable housing and into the homeless situation here. We've been talking about housing affordability on the show most of the week, right? With what's going on in construction and what's happening with the way that we handle affordable housing now. We let that kind of fall onto the developers' ballywick, for lack of a better term. When we say, okay, you have to give us X amount of percentage of your building to be affordable housing, but that number, nobody really can define it. I've often said that it has to be based on a situation. It has to be based on the tenant's financial situation, life situation. But that's not how it works now. Anyway, we're going to dig a little bit into that today when we welcome into the program from the Affordable Housing Association of Nova Scotia, Executive Director Michael Kabalen. You're listening to the Todd Veinotte Show. It's Wednesday. I'm Dan Alstrand. We're back in minutes. All right, welcome back. Radio stations upgrading their computers to Windows 11. Do you still call it Windows 11? Is that what it is? Is that what the proper terminology is anyway? And our engineering team working very diligently to try and get it done, and they did my computer yesterday, and it's working fine, but things look different, right? Things are in different spots, and there's things that pop up, and there's, and it's, it doesn't impact sort of how the whole thing works, but it just everything is not in the right spot, and it's bizarre, particularly for those of you listening today that work on computers every day. When something is there, but it's in a different spot, or there's a different way to find it, or there's a pop-up that pops up when you're not expecting it, it's disconcerting, isn't it? We get very used to the way things work. I know whenever the social media apps or big programs change things, when they do upgrades and they make enhancements to their product, I know there's always a lot of pushback because it's like, where did that button go? What's this doing? Anyway, if I'm a little more disjointed than usual, and I'm disjointed most times, that's what's going on, is I'm trying to find stuff where it used to be. We've been talking, as I mentioned before the break, we've been talking about affordable housing here on the program for a while now, and we focused a little bit on it this week. And when we had our visit with the Premier, I asked him if it was time that the province got into the affordable housing business or the social housing business, and he didn't really commit either way on it, saying that he understands that housing is an issue, but and they're working very hard, and I know that there's an announcement today later about how they're doing with housing starts and those kind of things. But what always it boils down to me is what is affordable, right? What is that magic number? And I don't think it exists. I think that what's affordable to me may not be affordable to you or to Vanessa or to anybody, right? It's a number that sits very solidly in your situation. And I don't think that the people that are trying to solve this affordability, or many of the people who are trying to solve this affordability crisis that we're having, are maybe not getting that. I'm very pleased to welcome to the program to give us a little context about this from the Affordable Housing Association of Nova Scotia. That's its Executive Director, Michael Kabalen. Michael, how are you?
I'm well. Good morning. How are you?
I am well. Is that what where we're at? And is that the big stumbling block here? Is that we just really don't know what affordable is?
I think there's a lot at play when we talk about what's affordable, because what has been affordable for a long time has changed. And people, an affordable apartment many years ago and was readily available was under $1,000 a month. Now that's scarce. And so I think people are, as you talked about earlier in the intro, people are defining affordable by what they can find that meets their needs. And there's lots of different ways to define what we might call an affordable housing. There's what came out of the American kind of housing institute in the post World War II, this 30% of a person's income, and that's kind of held for a long time. That's kind of been the lowest, but for some people, even that's too low, right? If you're only bringing in a few $100s a month due to you're on a fixed income, you're on a pension, that still may not be affordable to you. And so I think affordability is more about that it has to be tied to availability, because the more housing that there is available that isn't at the high end of the market, the more options people will have to find something that meets their needs for what they can afford to pay.
Right, because it's the basic principle of economics, right? It's supply versus demand.
Yeah, I think yes and no. I think we've allowed the basic economic principles to reign for quite a long time. Since the 90s, we haven't had a big engine of non-market housing occur right across the country, and particularly in Nova Scotia, the amount of new affordable housing or government-sponsored housing or public housing or whatever term you want to use has been relatively small, and we focused on the private market. And so simple economics haven't been enough, right? The free market, when there was a scarcity of housing, pushed rents up, and they probably aren't going to come down if we continue to focus on the free market principles. So I think, yeah, your point around supply and demand means there needs to be another type of housing that is available. It's what we do here at AHANS. We are builders, buyers, managers of a scaling portfolio of affordable housing. But for some context and for some numbers, non-market housing in Nova Scotia is less than 2% of the housing sector. That's really small when you think about what people are facing when they're looking for housing and they have to access a market housing unit. In the OECD average, so the other kind of developed countries across the world, that number's almost 7%. So, we're really behind in Nova Scotia relative to our peers. And in markets where you don't see a housing crisis emerge, it doesn't come this cycle of boom and bust and there's lots of housing available, so it's cheaper, or there's no housing available, so prices go up. That number is closer to 20% of the housing. It's non-market housing. It's run by the nonprofit sector, co-ops, and other organizations that make that housing available. So our advocacy is really the growth needs to be in the non-market housing sector. We need to see more investment in it. And, it's not that nothing's been done in that sector. The provincial government's been an exceptional partner to our sector to make investments in the types of housing and the types of projects that we bring forward. It's just that we still need to do more, right? It's not that nothing's been done. We still haven't done enough. And to get from that 2% to that 7% to that 20% is going to take many, many years and a significant amount of government investment and a lot of people joining the nonprofit housing sector.
Michael, just for clarity and context, can you tell me what non-market housing is?
So non-market housing is housing not owned by a for-profit entity. So most of the rental housing is and 98% of the rental housing available in Nova Scotia is owned by private interests. So that's the large REITs that get a lot of flack for whatever reason, and I think they're an easy target, but they're doing what they do, which is provide a lot of housing, and that also goes all the way down to people who are listening on the show who may own one investment property. But ultimately, that is market housing, right? That's been purchased as an investment, and it's going to do what it's supposed to do, which is generate a return for the person that's made that investment. Non-market housing has a different focus. It has a social focus. It's intended to create what I call forever affordable housing, or as affordable as you can within the expenses and the rents you're able to charge. So at AHANS, we're over 200 units now. And our rents are mixed. So we provide rents very low, as low as $200 or $300 a month to some people. And we provide some rents that are what we call near market rents. So those rents, might be $1,500 or $1,600 a month for an average unit as well. But when you blend those rents together, you get a financially sustainable portfolio of housing that continue to provide affordability and rents that are lower than your privately owned market housing, market unit rent. Available to people who deserve them and need them.
So then how do obviously the organizations like you have the same expenses and costs that somebody else, a developer or a landlord, has. How do you make that good? Do you get funding to assist people, or how does the funding model work?
So our model's unique in that we ask for government partnership at the start. So when we're buying or when we're building something, we do ask for government to come in. And so they would give us something called, what we would call a forgivable loan.
Right.
So they take an interest in the property. And then, so instead of us repaying them that loan back, you could almost imagine the loan payment goes instead towards subsidizing or reducing the rent for the tenants that we offer the housing to. That's one way we are able to bring rents down. The other way we do so is when we're building things, we build them environmentally sustainable. So we build to where we can to a passive or what's a net zero standard, or to simplify that for your listeners, we try to produce as much energy as the unit's going to consume. So we don't have to face those growing Nova Scotia power bills.
Right.
We don't have, we try to reduce water consumption so we don't have to face those growing Halifax water bills. We try to manage in a more effective way. We try to build to a standard where repairs will be less. So if we can minimize our operating costs, layer that with the reduction in debt repayment on the property, we can continue to provide affordable housing forever to our residents.
It's interesting, Michael, because whenever I hear about being environmentally friendly, I get a pushback from people saying, well, that's extremely expensive to do. Is it a more expensive upfront cost for you to build that, but it works out better in the long term? Is that the theory?
Well, I think, you get what you pay for.
Right.
And so for us, if our goal is to provide more affordable housing, in speaking to a lot of private developers, which I do often, we're bringing product to market at the same price or lower than private interests. We're building to that net zero standard. And so I think, if you partner with good developers, you partner with good builders, so you can get, I don't think you have to sacrifice quality. You don't have to sacrifice our environmental objectives with our financial objectives. And we've been able to demonstrate that for government time and time again as our partner, who continue to come to us and support our project. So I would disagree. I think if you're a private builder and your intention is to get the highest return on your investment, I can see why they see that as an additional cost, right, to invest in the environmental side. But where we are making that investment early on in order to reduce our operating costs forever, we don't see it as more expensive. And in fact, it's been proven it isn't more expensive the way we bring housing to market.
The other pushback I get, Michael, and we're just about out of time, is that it's fine to say that we're going to build all of these new houses, but there's just not enough hands to go around to build them. What's your thoughts on labor and getting these houses built?
It is very complicated. We're kind of stuck, right? We need more people to build. And, you're hearing lots of unique things in the media about some developers wanting to create work camps to house their workers. And so that's people facing real problems. They know they want to get product built. And I think, again, what we do is people want to build for us. So from our sector, people want to build something that is more than just for profit. And I think that, if there was more investment in affordable housing, people would make the choice to build it, because, money is one motivator for people, but doing good is another. There's a whole sector of folks in the nonprofit sector who've committed their careers to doing more than just well for themselves. They want to do well for their community. And so, I think CMHC's put data out that housing starts are down again over the last couple of years. And most of that is due to some labor, some material unavailability. It's also a lot of developers are pausing right now because there's a lot of unknowns with tariffs and what's going to happen with immigration. Is there going to be a market for this housing if they build these expensive units? And because of their costs, they're going to be expensive units. So I think, the opportunity is, can we get starts up, but bring those starts up in an affordable way? So partner with our sector and watch us build the type of housing that is necessary. But what it does require is government to continue to invest until we've built enough housing. Again, that 2% that we're at, that 7% that the rest of the developed world is at, or maybe let's push for that 20% that would make sure we never have a housing crisis again.
Michael, appreciate your time.
Thank you. Great to chat with you.
That is the Executive Director of the Affordable Housing Association of Nova Scotia, Michael Kabalen. We're going to stop. We're going to take another break here on the program. Blake's going to update us on what's going on the news. And on the other side of it, these numbers really shouldn't surprise you, but they're shocking nonetheless. 54,000 patients leaving Nova Scotia ERs before receiving treatment last year. Dr. Matthew Clarke, Chief Medical Information Officer with Nova Scotia Health, will be our guest. You're listening to The Todd Veinotte Show. I'm Dan Olstrand. We are back in a minute.
Imagine if today was the day your idea changed someone's life. Imagine if you could help someone pay for college, help your community build a new playground, or help a child make it to that dream competition. With GoFundMe, it's all possible. GoFundMe is the world's #1 fundraising platform, trusted by over 190 million people. Every week, ordinary people meet their goals and do extraordinary things. Your ideas matter. GoFundMe isn't just for emergencies. Want to raise money for your kid's soccer team, or raise funds for a small business, a creative project, or event? GoFundMe helps you turn ideas into reality. And help adds up. Fundraisers you start for someone else raise up to 5 times more. So think right now, who could use your help? Change rarely comes from waiting. It comes from someone deciding, today I'll start. Don't wait for someone else to bring change. Today, start your fundraiser in just minutes at GoFundMe.com. That's GoFundMe.com to start your fundraiser. GoFundMe.com. This is a commercial message brought to you by GoFundMe.
Welcome back to the Todd Veinotte Show. I'm Dan Olstrand. This shouldn't be much of a surprise for anybody that's been in an emergency room in Nova Scotia as of late, as they're busy, and we know that some people get in there, they get into the queue, they get triaged, and then they just leave because they don't want to stay around for the extended period of time that they're going to be there. This article from the Chronicle Herald reads, nearly 10% of patients left Nova Scotia's emergency rooms without being treated last year, according to a report published by the Montreal Economic Institute. Of the nearly 552,000 recorded emergency room visits in the province in 2024, 54,285 patients walked away before receiving care, mostly due to long wait times. Nova Scotia's early departure rate of 9.8% was above the national rate of 7.78%. The report also suggests that it's a worsening trend in Nova Scotia. Since 2019, the ratio of patients leaving has surged by 53.9%. We're pleased to welcome to the show today to give us a little bit of context on this, the Chief Medical Information Officer with Nova Scotia Health, and that is Dr. Matthew Clarke. Dr. Clarke, thanks for joining us.
Yeah, thanks so much for having me, Dan.
I don't think that is a big surprise for Nova Scotians. It just the numbers tend to sort of, open people's eyes a little bit that this is a problem and it's a growing problem.
Yeah, and I'm also an emergency department physician in Halifax at the QE2 and the Copaquid, so have, firsthand experience with this. So, yeah, certainly, I think no question, we obviously as a system and as healthcare providers want to make sure we provide care to everybody who needs it in the best way that we can. So certainly when we see numbers like this, yeah, no question, it's concerning and something we think, how can we do a better job of providing care? No question.
That's the $1 million question, isn't it? How do we fix this? Is there or are there plans underway to try and alleviate this?
Yeah, I think there's a lot already happening and that has happened. I think when I think about an issue like this, like with many issues in a complex healthcare system, it's very much multifactorial. Like there's a lot of pieces. So I don't know that there's one individual solution that would fix numbers like this. One of the things that comes to my mind as, an emergency department physician, when I'm working in the emergency department, there's different reasons why people present to an emergency department. So some people come to the emergency department and they're worried that they're experiencing a medical emergency, right? They're worried that they're having a heart attack, they're having severe abdominal pain, stroke symptoms, things that, they're worried about an emergency, and we absolutely need to make sure we have adequate resources to manage those cases. I also fairly regularly see patients who would say to me, Matt, I don't think I have an emergency. I don't know where else I could go. It's something I can't wait 3, 4, or 5 weeks. Like I do need this addressed. I know it's probably not an emergency, but I need care. So, and I think those are two different situations, right? And we want to make sure, nobody wants to spend time in an emergency department. I don't mean anybody in emerge who wants to be there, right? Like, no, it's not always an enjoyable place to be. It's a very stressful environment. So most patients, if they could find care elsewhere, would. So I think it's important to think about those patients as well and say, what options do we have available in our system to help people find care that is not the emergency department when that's appropriate. So certainly there are patients who absolutely need an emergency department. There's many people who may not. So there's been a lot of work on this. And I think a lot of people are hopefully becoming more aware of these options. So, there's, obviously if you have a family doctor, a nurse practitioner, like a primary care provider, a great place to go for care. But then also, there's, we have our urgent treatment centers, our mobile clinics, there's numerous virtual care options now. So trying to make sure people get to the right place, right? Our community pharmacy clinics, there's a very significant number of, what I would call like net new visits that didn't exist several years ago, like capacity in the system for things that may have otherwise had people thinking their only option was an emergency department, and now there's other options. And again, so that's, different to me how we want to solve it for folks, because obviously people who don't think they're experiencing an emergency, I don't know that the best plan is to try and improve emergency department capacity for those patients. They would actually, in many cases, prefer to get care somewhere else if it's not an emergency. So trying to figure out the right solution to the right problems. And again, that's complex. There's no one of those things solve the problem like this.
Dr. Clarke, is this backlog because there aren't enough doctors and nurses or nurse practitioners in the system, or is it an infrastructure problem, or is our increasing population resulting in more people, obviously more people, more sick people, more people need care?
Yeah, I think, again, not to be too repetitive,
Sure.
It is really like multifactorial, right? Like there's a lot of different factors at play here. I think, I think part of the equation is number of providers that we have in our system. But like with anything, it's how we manage the resources that we have. So how do we help flow people through the system, navigate people most appropriately through the system? How do we make sure that when somebody's seen, they're able to get their visit address in the most appropriate care location? So I think some of it is the volume of care that we're able to provide. I think that's a piece of it. But I think also a large piece of it is, how we move people and flow people through the system. I think, even just as an example, like our command center, so C3, our ability to make sure our beds are in our acute care system are optimized and in use, and there's less of a time where a bed might be empty waiting for the next patient to be able to use it, has helped sort of flow patients through our emergency department, because obviously still a significant problem in our emergency department is around patients who are in the emergency department but may need a bed upstairs, and that inhibits our ability to provide care for patients who still need our services in the emergency department. So I think, again, like a lot of pieces. And one of the challenges, obviously, is when we're trying to improve how patients navigate our system, that leads to some changes as well. So there's an awareness piece as well of helping people understand what their care options are for various issues. It's fantastic that we've enhanced scope for pharmacists as an example, but if we don't help patients connect with a pharmacist who can manage the issue that they have when it's appropriate, it means we have more work to do. So again, I think lots of pieces at play there.
Dr. Clarke, you mentioned virtual care, and I hear a lot of people discussing and talking about Maple, which is one of the apps that's out there that people are using. Is this, or have you seen an impact of these virtual care tools that we have available to us now in the ER? You work there, right?
Yeah. I mean, for sure. I think I see it. One of the big ways I see it the most is that it's given me a much better option for patients who may need follow-up or need something else, or what they can do if they're having trouble. So as an example, in the past, if I saw a patient in the emergency department and I thought they need some investigations, but it's not something that needs to happen today in the emergency department, but does need to happen, they need something in the next number of weeks or months or two or what have you. If they did not have a primary care provider, I didn't have a lot of options to help them get the care that they needed. Now with virtual care in Nova Scotia for patients who don't have a family doctor or nurse practitioner, I'm able to say, there's an option where you'll be able to, see a provider and get care for this and follow up. So it's certainly provided me, I feel like there's significantly more options for me when I'm discharging patients from the hospital. And then additionally, I mean, I have the advantage that I see the numbers of patients that we're seeing in virtual care, and get a sense of many of those likely would have ended up in an emergency department, or would have just not been able to get care anywhere. And then additionally, when I see patients who end up being referred from virtual care or end up in the emergency department after seeing virtual care, it kind of gives you a lens to the numbers of people that I actually didn't see, right? It's hard to always tell somebody if I'm in the emergency department and I don't see somebody, it's hard for me. I don't have visibility into that, but I certainly know from the numbers we're seeing significant numbers of patients able to access that service. And I think patients have been, certainly at virtual care is not the perfect solution for every presentation. Again, it's trying to connect patients with the best place for them to get care. But I think a lot of our citizens appreciate the convenience of that. The amount of time it takes to have a virtual care appointment for a relatively minor issue is obviously significantly more convenient for patients than spending hours in an emergency department.
Dr. Clarke, how about your colleagues? I know I have conversations with ER doctors quite frequently, and they say that it's busy and it's kind of stressful. What are your colleagues saying about this? And the second part of that question, we know that there's a big construction effort underway over there at the infirmary. Is that going to help things at all?
Yeah, great point. So I think, the emergency department, I'll be honest, is a challenging environment to work in, right? Like it's, there's a lot of complexity. There's a lot of patients. We obviously as providers, we're there, we want to help patients, we want to help patients. And so when you're not able to do that as well as you'd like to, I think that creates a lot of stress for folks. So certainly it's no question, it's my colleagues would, I think, almost universally agree. It is really challenging and really busy in emergency departments. I certainly think when you talk about some of the redevelopment work that we're doing, I think that's extremely important and absolutely will help. But again, I would say, I think there's a lot of things that are being worked on that will help, right? So I think certainly redevelopment, certainly, increasing capacity in our acute care system is really important and something that's being worked on. But I also think that the more we can help patients, I think that's great for folks who really need to be seen in an emergency department. What I think we want to make sure as a system, and I think what we need to drive to as a system, is make sure that everybody's getting care in the most appropriate place and the place that works for them. And I think, again, sometimes that is an emergency department, and absolutely we need to be there for those people. And sometimes it's an emergency department, though, only because a patient doesn't feel like they have or doesn't have another option to seek care, even though they're not worried that they have an emergency. And for those patients, I think we're doing them a disservice if we try to set up a system that says, well, we're still going to make sure that the place that you receive care is an emergency department. No, what the patient-centered way, in my opinion, to think about that is to say, how do we find the right places for those patients? So patients who may not have an emergency but have, let's call it an urgent issue that needs to be addressed, but maybe not in an emergency department. So certainly I think redevelopment is part of that, some of the, what's happening at the QE2 for sure. The other thing to remember about our left without being seen data that I just want to make sure I've mentioned is
Sure.
It does include a lot of other numbers, so not always fully reflective of the situation. So I think it's a very concerning number. I think it's something that we absolutely think about. But that data would include, those numbers would include patients who may have, seen a provider or seen somebody but didn't wait to complete care. So decide I don't want to wait, I'm not willing to wait, or I'm not able to wait to complete my care journey. That would include, patients who show up at a rural emergency department that's not open 24/7, who get triaged and are either not appropriate or decline a virtual care option and are redirected somewhere else, like, a pharmacy or primary care or another emergency department. It would include those patients. If you've seen a provider, a non-physician provider within their scope of practice, it would include those cases. So it does include some of our other pathways that may have still gotten the patient to an avenue of care, but not in that emergency department in the traditional way. So I just wanted to highlight that as well. But, certainly to answer the question, I think redevelopment is really important. It's certainly something that I'm really excited about, seeing that work when I go into the Halifax Infirmary to do a shift, seeing the ongoing work there, I think is really exciting to see and really important. And then certainly hopefully will help our ability to provide care. But I think what I think is really important to remember is there are many of our pieces of our system that for many years weren't upkept the way they maybe should have been or needed to be. So there's, I think, a lot of work to do in a lot of different ways. And I think part of what my role is in my role around digital health is trying to figure out how do we leverage technology and digital health tools to even think about what are different and novel ways we can provide care to get the best value out of the money we're spending on healthcare.
Dr. Clarke, I know you're extremely busy, and I appreciate you spending a few minutes with us today.
Yeah, no, thanks so much for this. Really appreciate your time, and thanks for having this conversation.
This is Dr. Matthew Clarke, Chief Medical Information Officer at Nova Scotia Health. When we come back, planning and acquiring nursing home beds, a conversation with the ACE teams. Gary McLeod, the Chair of Advocates for the Care of the Elderly, will be your guest. You're listening to the Todd Veinotte Show. I'm Dan Ostrand. We're back in minutes. If you remember back last week, the Auditor General released a report on nursing home beds that had a bunch of recommendations that were handed out to the government. The government said they were going to do all 10 of them, I do believe. And, of course, nursing home beds and nursing homes and care for the elderly is sort of the wheelhouse of our next guest. And he joins us from the Advocates for the Care for the Elderly, and that's Gary McLeod. Gary, how are you?
Good morning, Dan. Thanks for taking this interview because I think it's a really important issue.
All right, tell me what your thoughts were with what the Auditor General or the Auditor General uncovered in that investigation.
Well, we've been in touch with the Auditor General's office for over the last several years, and they have agreed to do some research on long-term care, and I'm glad this was one of them. And she brought lots to light that needs to be addressed, and I liked her report. And but what's left out of it is for not-for-profits to be included in the procurement, the process,
right?
So that there should be more competition with this. Especially for not-for-profits, because the care is better in to some degree in not-for-profits, and the bottom line is such that that patients get better care.
How does it work now, Gary? How does the current process work when these bids come up?
Like this is totally something new. But in the past, they were let out. It goes back over 10 years, almost 20 years to Rodney McDonald's term in power, and they had a 10-year long-term care plan for 1,500 bids that never were completed. So it's always been an issue. And then they were defeated by the NDP, who completed 900 of those bids. 600 were still left undone. And then when the Liberals came into power, I think there was several hundred that were created under new builds, especially with the hospital in Cape Breton. I think there was bids included in that. So it's always been a wishy-washy thing. I don't know why they know what the demographic was or is, and boomers were going to be needing those bids. And to have 5,700 new bids completed by 2032, a lot of us boomers are going to be well into their 80s and maybe not even see those bids. But I just think that it's been a stumbling way to do things when they know that these things were needed. And as a result of that, we have people waiting in hospitals still, even with the creation of the transitional care unit out on Hogan's Court. That Shanix has been awarded. It's $1 billion contract over 10 years, that I understand. So that's what I know about it in general, and it seems that the for-profits like GEM and Shanix are the big winners in most of it.
Right, and you said earlier that the care is better in not-for-profits. Gary, can you expand on that a little bit?
Well, we have the 4.1 hours, for example, that were increased. This is 4.1 hours of attention per resident in nursing homes, and we fought for that for forever. And the Houston government has been very good in listening to a lot of the things that we were asking for: new bids, increased number of hours per patient, and increased salaries for CCAs. All of that came true in the sense that they are working on it. We have to give them kudos for that. But the cogs of the long-term care are still broken. It's not often that we get in to see patients in residents in long-term care facilities, but we just happened to visit one this last week, and and what left me with, and we visited with some of the residents and listened to what they had to say, and this one gentleman, he said he never had a bath for 3 months. So wow. And this is for a for-profit facility. And there were double rooms still in the facility. So a lot of these facilities that I think that are supposed to be converting over to single rooms, they're lagging. And that needs to be addressed. Only a curtain between this gentleman and the other resident that was alongside of him. Now, to my mind, they're supposed to separate people. That this gentleman that I spoke to had all of these faculties, except that he needs nursing home care. But in the next bid, there was someone that had dementia, and you can't fault them for what they do, but they're not able to control their actions, and they're left screaming for help, and not knowing where they are and such. So anyway, the gentleman now has a single room. Unfortunately, someone had to pass away for him to get it. So that's the kind of thing that goes on in nursing homes, and hopefully they will have a way to increase the number of single beds. Right. I mean, they're not totally new builds. They're single, renovated, and new bedrooms. That's the plan, and by 2032, that's 7 years away still. Hopefully, and I think the Auditor General's report said that was only 4 that were near completion and 1 still ongoing. So that's a total of 5. I don't know how they're going to reach that number of bids in that time. And my understanding is that there's supposed to be only 100 bids per facility. I've been in another brand new facility that just recently, and the care in that one, it was for profit as well. It doesn't seem like the 4.1 hours is being reached from the meeting that I had with the families just on this weekend. It sounds to me like it's still 8-1, which indicates that eight residents to 1 CCA. And that indicates that the 4.1 hours are still not being met, Dan.
Gary, we're out of time. I appreciate you joining us today.
Well, thank you, Dan, for allowing us to keep on with this. Your show is terrific. You and Todd and Rick Howe, God bless his soul, are just great in helping us to address this issue.
Have a good day, Gary. That's Gary McLeod from the ACE Network. We're going to stop. Blake's going to update us on what's going on in the news. On the other side of it, Dr. John Gillis will be here to answer your medical-related questions. If you have a medical concern, maybe want a second opinion, 902-405-6000 or 1-877-801-8255. That's your go-to numbers. The lines are open. House calls after the news.
Imagine if today was the day your idea changed someone's life. Imagine if you could help someone pay for college, help your community build a new playground, or help a child make it to that dream competition. With GoFundMe, it's all possible. GoFundMe is the world's #1 fundraising platform trusted by over 190 million people. Every week, ordinary people meet their goals and do extraordinary things. Your ideas matter. GoFundMe isn't just for emergencies. Want to raise money for your kid's soccer team or raise funds for a small business, a creative project, or event? GoFundMe helps you turn ideas into reality. And help adds up. Fundraisers you start for someone else raise up to 5 times more. So think right now, who could use your help? Change rarely comes from waiting. It comes from someone deciding, today I'll start. Don't wait for someone else to bring change. Today, start your fundraiser in just minutes at GoFundMe.com. That's GoFundMe.com to start your fundraiser. GoFundMe.com. This is a commercial message brought to you by GoFundMe.
Welcome back to the Todd Veinotte Show. It's Wednesday. It's just after the news at 11, and that means it's time now for house calls. If you have a medical question, perhaps you'd like a second opinion on something, here's an opportunity to get it right here on the radio. 902-405-6000 or 1-877-801-8255. Again, 902-405-6000 or 1-877-801-8255. Your chance to ask the good doctor some questions, and we're very pleased to welcome back to the program Dr. John Gillis. Dr. John, how are you?
How's it going?
Good. Big game coming up on Saturday. You going over for it?
Oh, yeah. I'm heading out tomorrow night.
Nice.
Just putting some final touches. There's a World Cup final featuring the Canadian women in England. So it's going to be 82,000 people for this one. So it's quite something.
Are they playing that in the National Rugby Stadium there?
They are at Twickenham, which is, again, it's an amazing accomplishment by, our women's team, by, the whole organizers of this tournament. The last World Cup final in New Zealand had 40,000 people. Before that, they might have gotten 15 or 20. And it's incredible to see the support for this, these amazing teams and this great sport. It's going to be quite an event.
The Canadian women played New Zealand in the semifinal, and that was a fun game to watch.
They were amazing, and they'd beaten them once before and tied them, but I'm not sure people still fully believe they could get the job done. Because New Zealand had won the last 3 World Cups, but from the opening whistle, there was no question. They were all over it, and every bit of it was amazing. It was incredible to watch their performance.
So what does England bring to the stage?
Well, England haven't lost a game in 3 years. They're ranked #1 in the world, and they're playing in their home stadium, probably in front of 60,000 of their countrymen and women, so they're formidable. Our team is going to have to, play to their skins as they've been doing consistently, and I believe they can do it. But they're going to have to put in a shift, and but the support's been incredible. I mean, this watch party's planned all over the city. The Admiral Club at Graves Oakley in Spryfield will be showing it. I think there's a number of places showing it. I think Nellie's downtown is showing it. Probably the Celtic Corner and a few other places where people tend to gather to watch rugby. And noon on Saturday. It's 4:00 UK time, so it should be a wild one.
It'll be on the TV in my house, and we'll keep an eye out for you in the crowd, Dr. John.
Indeed.
902-405-6000, 1-877-801-8255. This is House Calls. Dr. John, of course, the big headlines this week was some comments from the President of the United States on acetaminophen. I can say it, he couldn't. Acetaminophen use in pregnant women. He was advising women not to take it. You're the doctor. Is this safe?
Yeah, I mean, we've said for years that it's safe. The one of the memes running around, that we don't necessarily pay attention to memes, but Tylenol was invented in the late 50s, early 60s, and autism has been around for a long time. Tylenol does not cause autism, and there's no credible evidence that it does, and that's what all the scientific people are saying. There's one paper out there that suggests a possible correlation, and somebody jumped on that and has taken it too far. I don't know anybody in the medical world who takes this seriously, but I mean it goes along with a lot of other ridiculous misinformation about vaccines, and just scary to watch. I mean, the man can't even say acetaminophen, but he's telling people not to use it, and it's scary deflection, I guess is what I would say.
Why is it important for women that are pregnant to take these kind of drugs, Dr. John? What's it used for?
Well, I mean, the biggest reason we use acetaminophen, particularly in pregnancy, is it's really the only drug that's felt to be safe in pregnancy. You can't use anti-inflammatories because there's a clear correlation with a whole host of problems. Opiates cause, suppression of function, and the fetus can become dependent on them. I mean, in some cases we have to. If a woman's having intractable pain or surgery or, childbirth for a temporary period of time, it's okay. But, Tylenol has been the mainstay for a long time. And to come up with this without credible information is quite frustrating. Especially in the context of where this is coming from.
902-405-6000, 902-405-6000, or 1-877-801-8255. Dr. John will begin with David on the phone. David, welcome to the show.
Hi, doctor. I've sort of been experiencing persistent bloating after eating for maybe like the last month or so. So I'm going to go to my walk-in clinic and get that checked out. Sort of the other thing I'm curious about is maybe just colon cancer screening. One possible reason I might be interested in that is just that sort of this summer it seems like I've developed asthma, or at least I went to the hospital a couple times and there's no problem with my heart kind of thing. So it sort of seemed that asthma was a remaining possibility. I had a blood test done I was 2 separate visits, and each time I had blood test done. So I assume they would have checked for anemia, but I can't remember that sort of being discussed or whatever. So I'm just curious what your thoughts are, and in terms of like the colon cancer screening, what's involved in that. And I am 44, so I'm sort of below the age where it's, what do you call it, sort of
recommended.
Routine. Yeah, recommended, and you get the kit mailed out to you and stuff like that. But, at the same time, there's a lot of people now in their 40s coming down with that and stuff. So maybe just want to be on top of that. So, just curious what you might have to say.
Yes, my first question is, why does your mind go to colon cancer? What's leading you there?
Well, just like it's just weird, sort of, the bloating and indigestion and all that kind of stuff. I mean, I've also sort of had kind of like stomach's been an issue for me over the years. Like on the one hand, I have sort of, very like high metabolism, and digest very quickly, get a lot of energy from it. But, it's sort of things like stomach sensitivities and, can't drink black coffee and stay away from fizzy drinks and things like that kind of seem to cause discomfort. But, I suppose just, the sort of in the media anyway, sort of talk about, it's becoming much more prevalent in the, the under 50 population and stuff. So maybe just being on top of that, erring on the side of caution.
Yeah, so the biggest, what the stool tests look for in people over 50 is blood. What I tell people is, if you notice an obvious change in your bowel habit, meaning, it's thinner or thicker or it's bloody, something's changed, it's definitely worth getting checked or screened. Bloating or a bit of heartburn is pretty non-specific. That doesn't, turn my mind to colon cancer per se. But again, if you're concerned, you can always, get someone to check you. We do test for blood in the office with the kits we have in the office from time to time. Usually wouldn't just go looking for it unless there was a reason to. If someone had a change in their bowel habit or was having pain or had reported blood, we would then maybe look for blood. And you can still get a stool tested for blood if there's a reason to do it. We're not going to mail you the kit if you're under 50, but, your doctor or a walk-in or whoever you might be able to see, could still send you for a stool test if you're concerned. But again, that's not where my head would go just with those sort of general symptoms. But again, if you're concerned, you could follow that pathway.
David, appreciate the call. Best of luck. 902-405-6000, 1-877-801-8255. House Calls continues after the break. Welcome back to the Wednesday edition of the Todd Veinotte Show. It's House Calls. He is Dr. John Gillis. The number is 902-405-6000 or 1-877-801-8255. If you have a medical question, the doctor's here to answer it. Let's go right to the phones, and we welcome Todd to the show. Oops, I lost Dr. John. I knew he was going to do that. Todd, I'm going to put you on hold, and Vanessa's going to connect back up to him. It's big fingers. Big fingers and little buttons. Anyway, we'll get Dr. John back on the air. Don't forget, because we're doing House Calls this hour, we will open up the telephone lines for the open hour after noon today. So if you've got something you want to talk about, lots of stuff in the news, that will be your opportunity to join us then. Let's try this again. My apologies, Dr. John. I got big fingers and they got in the way. Are you there?
Sounds good.
All right, let's stick you on there. Back. We're back. We got you, and I appreciate it. Let's welcome Todd to the show. Todd, how are you?
Good. How you doing?
Good. Your question for Dr. John, please.
I'm 50. I'm average. I have blood tests done, and they're all my hemoglobin and iron and all that is normal, but then my ferritin is really low. Like it's like 20. I'm just wondering what would cause that, and I don't know.
Probably, two major things. One is you absorb iron poorly, or two, you're not taking enough in, or possibly a combination of both. So, ferritin is a measure of iron. When it's high, it can be an inflammatory marker. 20 is low. It's not, it varies, but so often people need to be a little bit lower than that before it starts to make a difference. What we start to see when iron gets low is the first thing we see is the red blood cells get smaller. We call that, microcytic anemia, but the total number may be still okay. And then when iron gets really low, the size and the number goes down. So, the solution for you, obviously talk to your healthcare provider, is to figure out, is this a dietary thing? Do you need to start, licking frying pans or eating more steak? Or is this possibly an absorption thing that, you may need to modify your diet or, take some supplements to help it out? But again, that is low. The good news, as you said, is that your blood counts are not down yet. Hopefully you can find a way either with diets or supplements to boost that so you don't have a problem.
Todd, I appreciate it. Best of luck. 902-405-6000, 1-877-801-8255. Before we go back to the phones, Dr. John got an email question. It says, hey, Dr. John, I found a tick embedded on my leg a couple of days ago. It's dead. I think it was dead in my leg. I pulled it out and I saved it. Now, should I go to the doctor or wait for symptoms to appear if there are any symptoms? And I'm not sure what kind of tick it was.
Yeah, so usually we worry if something's been there for more than 24 hours. they say a tick must be attached for 24 hours to transmit Lyme disease, and that's assuming it's the type of tick, that does cause Lyme disease. So my advice to people usually is if it's been there for less than 24 hours and you're pretty sure everything's out, watch for any sign of a bullseye rash or any other symptoms, and just monitor carefully. I wouldn't necessarily run to get checked. I just keep an eye on it. It's probably the best advice.
Is this the emergency room, or can pharmacists now deal with ticks? Can they not?
They can. I mean, it's there's and this is not directed towards pharmacists. Just to be clear, there's a bit of a tendency, in my opinion, to just treat everybody that's got a tick on them, and I think that's overkill. I think it's bad for antibiotic resistance. So whoever you're talking to, make sure you tell them the story and look for symptoms. I'm not personally a fan of just treating anybody who's been bit by a tick, because it's again, the antibiotics stop working after a while.
Right. 902-405-6000 or 1-877-801-8255. It's the black-legged tick is the Lyme disease carrier here in Nova Scotia. Another email question, Dr. John. It says, in May, I was diagnosed with bladder cancer. I was told I have two types of bladder cancer, one of which is a rare cancer. I was treated for 6 treatments in 6 weeks with a BCG treatment, which I was told was based on the TB virus. I recently had a scope to see if the treatments had any success, and if the treatments would continue. I was told the scope proved to be inconclusive, and will now have to have another biopsy, as the BCG treatment can hit or miss with this rare version of bladder cancer I have. Does the doctor have any idea of what this rare bladder cancer is? I've meant to ask my urologist, but always forget.
I'm not sure I can help with that. There are many subtypes. I'd be guessing if I was, that wouldn't be the right thing to do.
Best thing.
BCG is a weakened tuberculosis strain, which, interestingly enough, has been shown to help treat and eliminate different types of cancers, including bladder cancer. So it's sort of a unique localized treatment that was discovered over the years working with this particular substance, and still very effective and still commonly used. But I can't tell you without more information. I mean, rare is a relative term. There are many subtypes.
Right. And very quickly before our next break, Dr. John, another email question. It says, hey, Doc, is it possible to develop lactose intolerance later in life? I've been drinking milk my entire life, but recently have started to feel bloated and gassy when I drink milk or eat cheese.
Yeah, no, it is possible, and I think the reason for it is your body may produce less of the enzyme as you age. For most people, that doesn't happen to a serious degree. For some people, they start to notice a change, and they just have to sort of watch the amount that they eat. People that, like when I was a teenager, I used to drink 6 liters of milk a day, something stupid. I don't do that anymore, but I'm not bothered by it. Some people find, stuff they like the email said, people have, had milk and cheese their whole lives. They notice that the volume of it can bother them. So, typically the answer is just to moderate it a little bit. Certainly if it's becoming a bigger problem, you can use, lactose-free milk and that sort of thing. For most people, they don't need to do that. They just need to sort of keep an eye on the double cheese pizzas and the 2 liters of milk to wash it down.
If you are lactose intolerant, Dr. John, is there a medical solution to that, or is that something you just have to monitor the symptoms on?
It's really just monitoring your intake and, right. There are pills you can take, enzyme pills to help, and, a combination of those and, moderating your intake or using products that are, lactose free.
It is when we have this show, I always feel hungry after with donaires and cheese pizzas.
Yeah, I know. We should go get some.
Dr. John's here for the next 30 minutes. If you have a medical-related question, lines are wide open. Good chance to do so. 902-405-6000 or 1-877-801-8255. House Halls continues after the news.
Imagine if today was the day your idea changed someone's life. Imagine if you could help someone pay for college, help your community build a new playground, or help a child make it to that dream competition. With GoFundMe, it's all possible. GoFundMe is the world's #1 fundraising platform trusted by over 190 million people. Every week, ordinary people meet their goals and do extraordinary things. Your ideas matter. GoFundMe isn't just for emergencies. Want to raise money for your kid's soccer team or raise funds for a small business, a creative project, or event? GoFundMe helps you turn ideas into reality. And help adds up. Fundraisers you start for someone else raise up to 5 times more. So think right now, who could use your help? Change rarely comes from waiting. It comes from someone deciding, today I'll start. Don't wait for someone else to bring change. Today, start your fundraiser in just minutes at GoFundMe.com. That's GoFundMe.com to start your fundraiser. GoFundMe.com. This is a commercial message brought to you by GoFundMe.
All right, welcome back. This is the Todd Veinotte Show, and it is House Calls. He is Dr. John Gillis. If you have a medical-related question, your chance to get some medical advice from the good doctor, 902-405-6000 or 1-877-801-8255 is the number. Dr. John, I'm going to go right to the phones, and we'll welcome Joe to the show. Joe, how are you?
Not bad. Thanks, Dan. Good morning, gentlemen. Dr. John, this is kind of a random thing for me, but the other morning, and it only happens in the morning when I wake up. I usually sleep on my left side, and in my right testy, I get this kind of an ache. And usually when I wake up, if I move my right leg, it's usually pretty subtle. But the other morning, I woke up and I'm pretty tolerant of pain. I played a lot of football and rugby and any other sport where it was anyway. But this particular morning, it was a real heavy ache. Like I say, in my right testy, and like I actually said "ow" out loud, which is not a common thing for me. So. Just wondering, what am I experiencing? I guess if that's enough information.
When was this, and is it still happening?
Yeah, it's been happening probably for over a year now, but it's random. Like I say, this was probably about a week ago. Haven't experienced anything like that the last couple of nights. But yeah, like I say, it seems to be kind of random, but it's been going on for a bit. But this last one was, substantial.
Does it hurt to touch, or you just feel pain in the area?
No, nothing through the day at all. It doesn't hurt to touch. It's like I say, it's just when I wake up in the morning. I usually don't toss and turn too much at night. Like once I'm down, I wake up in the same spot that I laid in, sort of thing. So.
Yeah, it's tough to say, obviously, without looking at it. If it's only in the morning, it's probably something that's positional. You may just be sleeping with, putting some pressure on the area by the way you're sleeping. It could be an early hernia that, is putting some pressure down. When you're lying down and when you get up and moving, it sort of relocates itself. It would be odd to, you don't just have an infection that comes and goes or is only there for a few minutes in the morning. Same thing with torsions. If you had a twisted testicle, you'd know it. It's one of the most painful things out there. Again, they occasionally get rid of themselves, but they don't just come and go.
Okay.
So I guess the summary of that is, you should probably get someone to take a look at it, see if there's any sign of a hernia, see if there's any sign of swelling. There's another common problem is what we call epididymitis, which is a swelling of the top of the testicle. But again, it doesn't usually just come and go, and it, would not be expected to be just in the morning. So I suspect it's probably something positional, and it may be just the way you're sleeping, putting pressure on the area, or an early hernia. But probably worth having someone take a look around.
Right. Okay, I appreciate the info. Thanks very much, Doc.
Thanks, Joe. Appreciate it. 902, best of luck. 902-405-6000 or 1-877-801-8255. Back to the phones, and we welcome Bruce to the show. Bruce, how are you?
I'm good. How are you doing?
Good. Your question for the doctor, please.
Yeah, so I had a similar thing. When I sleep on my right side, my right testicle hurts. Is that something I could get alleviated, or?
The show is nuts today. I don't know what to say about it.
I knew that was coming. I knew it was.
Yeah. No, again, as I said, I that's a hard thing to diagnose without taking a look at something. It's likely positional. If it's only in the morning, it's probably how you're sleeping. Look at how you're sleeping. Get someone to look to see if they have any sign of a hernia or other swelling, and you need a proper diagnosis, I guess, is the bottom line, which is hard to give on the radio.
Okay, thank you.
Thanks, Bruce. Appreciate it. 902-405-6000, 1-877-801-8255. If you have a question for the good doctor, here's an opportunity. Lines are wide open for you. You can get right on. I got another email question, Dr. John, and I'm curious of this because I sometimes suffer from this as well. It says, hey, Doc, I suffer from tinnitus. I've been to the doctor who irrigated my ears, but they're still ringing. And every once in a while, they will pop like they do when you're on an airplane. I'm wondering if there's anything else I can do.
Tinnitus or tinnitus, depending on who you talk to, is a sensation of ringing in the ears, is a very hard condition to, I guess on one level analyze and diagnose, but also to treat. And people experience it differently. Some people say it sounds like a humming sound. Some people more like a whooshing sound. The most common cause is noise pollution or noise damage over time. Medications can cause it. So the biggest thing is to determine, is there a correctable cause of it? Is there a medication causing it? Wax or fluid buildup in the ear can cause a sensation like it. So we usually look to make sure people aren't plugged or that they don't have a lot of fluid in the ears. But it can be a tough thing to treat depending on how bad it is. Noise can or white noise devices, can be helpful to sort of distract the brain from it. So the first step is to get a proper examination of the ear on the affected side, see if there's anything, like wax or fluid that's modifiable, and then to take it from there. Sometimes it needs an ENT referral, but it is a tough thing to treat. It's not, it's not like I get a toe infection, here's some antibiotics, it's gone. It can be a challenge to get rid of or to manage.
It can be life altering. I can tell you, I suffer from it, and I can't sleep some nights without having white noise in there.
Yeah, no, it can be really debilitating for some people, and if people have early signs of it, they definitely should get themselves checked.
It's a result of many years of headphones. That's mine. Anyway, 902-405-6000, 1-877-801-8255. We're going to take a break, take the last break of house calls here. Dr. John will be back on the other side of it. You're listening to the Todd Veinotte Show. I'm Dan Alstrand. We're back in minutes. Welcome back to the Todd Veinotte Show. It's House Calls. He's Dr. John Gillis, 902-405-6000 or 1-877-801-8255. If you have a medical question, Dr. Gillis is here right up until the top of the hour to answer it. We'll go right to the phones, and we welcome Russia to the program. Russia, how are you?
Good. How are you today?
Good. Your question for the doctor, please.
Hi, doctor. How are you today? I heard you talking about lactose intolerance and what we need to do in order to live with it. My question is, my son, when he was first born, he was born with lactose intolerance, but I kind of forced him to drink regular milk and have cheese and everything, but he does not. Like right now, he's healthy. He does not have any problems with lactose intolerance, but does that mean it could come back or it could hurt him or have a negative effect on him in the future? He's 16 right now. He was diagnosed with it when he was first born.
Well, some kids have an intolerance to different foods that sometimes, maybe it was a mild lactose intolerance that he's grown out of. Maybe it was something else that was misconstrued. The bottom line is if he's tolerating these foods now, and I don't see why he wouldn't be fine. If he was still truly lactose intolerant, he would not tolerate them. So, if he's doing well, carry on. I mean, theoretically, anything you can develop it later in life, as your lactase production goes down, but that's pretty uncommon. It sounds like if he's doing good and is growing and eating well, then have at her. So, sounds like it's all good.
Appreciate the call, Russia. Best of luck. 902-405-6000 or 1-877-801-8255. We have another question about testicles, Dr. John. Here's Pete. Hi, Pete. How are you?
I'm great. How's it going today?
Good. Your question, please.
Yeah, no, it's not actually a question. It's just a comment. I had the same problem, and it was really bad, sleeping on my side. And then I was told, use a hugger pillow. You're pinching yourself when you turn over. I used the hugger pillow between my thighs when I go to sleep on my side. Never again.
There you go. Thanks, Pete.
Okay, bye.
Appreciate it. 902-405-6000 or 1-877-801-8255. Dr. John, one more email question here. It said, hey, Doc, I'm 20 years old, active in sports. When I turn my head all the way to the right, I feel and hear cracking in my neck. It doesn't hurt, but it sounds kind of scary, wondering what it is.
The cracking is usually just air being released or, tendons, moving along or over each other. It's rarely anything serious. So, if you're not having any symptoms of weakness, numbness, or anything else, I wouldn't worry too much about it. A little unusual at that age, but, a lot of people, can crack their knuckles, their joints. My neck makes a great sound, as does my right knee when I move it too much. So I wouldn't worry too much.
It's all the years on the pitch, I imagine.
Something like that, or sleeping funny, as we've learned today.
Hugger pillow, Dr. John. You got to get yourself a hugger pillow.
Got to get myself a hugger pillow. It'll keep things right.
All right, Dr. John, we're going to give you a couple of minutes back. Thanks for joining us today. Have a safe flight, and go Canada, go.
Good to talk to you. Talk to you next week.
That is Dr. John Gillis here every week to answer your questions. If you have a medical-related question, sometimes hard to get advice, right? So it's a good opportunity for you to get some advice and move on with your day. Now, the open hour, of course, is going to happen after the news at the top of the hour, and there is an awful lot to talk about out there today. We talked about this yesterday on the program, and that is the ballooning deficit that the province has, and listening to the scrums. And for those of you who don't know what I'm talking about, the scrum is the gathering of reporters after at the provincial legislature after question period, and the Premier, of course, was asked a number of questions with regards to this deficit, and one of the questions that the Premier said or was asked was if Nova Scotians have reason to be worried about this deficit or the fact that it has risen by almost $700 million since February's budget. And Tim Houston said, Nova Scotians should feel confident that their government understands their needs and is willing to invest in them, he said, and I quote, "We've been very clear we will invest in making sure Nova Scotians have access to health care. It's expensive. This is the reason why the Liberals couldn't deliver health care, because it was expensive. We're not looking away from the challenge of the day." Houston wouldn't also say if his government is planning to cut spending, only that he's concentrating on growing the economy so the province can continue to provide services to Nova Scotians at a, quote, increasing level. So basically what the Premier said yesterday when asked about that $1.2 billion deficit that the province is facing, or the 70% increase in that deficit between today and February, is not to worry about it. Well, I'm kind of worried about it. And if the numbers that we had yesterday are any indication, I think many of you are worried about it, considering that the servicing our debt is the first $800 and change of tax you pay every year is going just to service the debt before we do anything with it. Might be something you want to talk about in the open hour. Yesterday, Halifax City Council defeated a motion from city staff to defer and have now moved first reading of a new bylaw that will protect Dartmouth Cove and that side of the waterfront over on the Dartmouth side. Sam Austin, councillor for that area, was the mover of this said piece of legislation. There was a lengthy debate, as there has been for the last couple of council meetings surrounding this. Lots of discussion on the council floor about jurisdiction and if the city had the jurisdiction to do this. Some councillors who were speaking on this yesterday, saying that the city really doesn't have any jurisdiction here. Infilling is a federal government responsibility because the Halifax Harbor is a working harbor. Others say that's not the case, and they have to protect the shoreline up to the high water mark, which would then become city property. It's a jurisdictional debate and a jurisdictional fight. But the interesting part is, and I have an email from somebody, and I'll read it after the news at the top of the hour, from one of the landowners there that was obviously disappointed in council's move yesterday. And without coming out and forthright saying it in a statement, but I think alluding to it, is that they're going to pursue maybe some legal action with regards to this. What I can tell you is that when council was debating this yesterday and somebody asked that question, I don't remember what councillor it was, asked that question yesterday. I think it was Councillor Purdy, to be honest. The council immediately said no, or the city solicitor immediately said, yeah, there are some legal documents here, there is some legal advice here, and then they went in camera, which means they clear the room and they go behind closed doors to discuss this stuff, which I think is appropriate because it involves legal action. So I think we haven't heard the end of Dartmouth Cove. Most of the councillors who spoke on this yesterday said that they had received lots of communication from people in the area and in their jurisdictions and in their districts about this. I'm curious as to what your thoughts are on the infilling at Dartmouth Cove. We'll take those calls coming up after the top of the hour as well. And have you been following this story? It was on the news yesterday and on the floor of the House of Commons yesterday. The public safety minister in I'm going to say, a hot water after being, I think, secretly recorded by an acquaintance or a friend talking about the gun buyback program. Of course, the news that came out of Ottawa yesterday on this is that the federal government is going to do a pilot project on the gun buyback program, and it's going to be in Cape Breton, which is, of course, here in Nova Scotia, and they're going to test things out here. But what the real controversy surrounding this, I know that the gun buyback program itself is controversial. But the real controversy here is some of the comments that the public safety minister made during this secretly recorded conversation with an acquaintance, a colleague, a friend, maybe. I don't think it was anybody in politics. Anyway, the audio of that was leaked out to different organizations and is now very prevalent around the internets. There was a lot of things that the public safety minister said, but one of them that kind of stuck out to me is that he said, and this is a direct quote, "Quebec is in a different place than other parts of Canada, right? And this is something that is very much a big, big, big deal for many of the Quebec electorate that voted for us." He went on to say, "I'm sure you've seen the articles where people have said, this is one of the things that we should not execute like it's as a change from Trudeau's policies, but we've made the decision to go ahead." He also alluded that the Prime Minister put this into his mandate that he was to go ahead with this. But the other part of the equation was that the public safety minister said that he didn't think that local police forces had the resources to enforce this, and that it was going to be capped. I think it's $795 million or whatever the number is, but they're going to cap the amount of money. And part of that conversation that the public safety minister had with this person was the person that is unidentified in the video said that, I have some weapons, some rifles and such that are, valued at, I'm just going to throw a number out there, at $2,100. All you're offering me is $1,200. I'm going to lose money on this. And with this program to be capped, at $700 million. It won't take very long to eat that much money up in the system. Then what happens? Pierre Poilievre and the Conservative Party calling him out yesterday on the floor of the House of Commons, saying that he should be fired for these comments. Is this good policy, or is this politics? That's the question that's being asked about this gun buyback program, and I'm very curious as to what you think about it. If this is just something that is being done as a political move, or is this truly being done to protect Canadians, as the public safety minister said yesterday? That's on the agenda as well. And, of course, debt, more debt, and debt financing. City Council voting yesterday to take another debenture up, $45 million for debt financing of some of the projects that are going on here. That number is going to balloon. I think we're at 200 and don't quote me, but we're at $270 million, I think, is the amount of debt that we're into now as part of the municipality. That number to balloon to $480 million in 4 years, $1.4 billion in debt financing for the city of HRM. That seems like an awful lot of money to me. All of that and a whole lot more. The open hour will start right after the news at noon. The numbers are 902-405-6000 or 1-877-801-8255. The Todd Veinotte Show continues after the break.
Imagine if today was the day your idea changed someone's life. Imagine if you could help someone pay for college, help your community build a new playground, or help a child make it to that dream competition. With GoFundMe, it's all possible. GoFundMe is the world's #1 fundraising platform, trusted by over 190 million people. Every week, ordinary people meet their goals and do extraordinary things. Your ideas matter. GoFundMe isn't just for emergencies. Want to raise money for your kid's soccer team, or raise funds for a small business, a creative project, or event? GoFundMe helps you turn ideas into reality. And help adds up. Fundraisers you start for someone else raise up to 5 times more. So think right now, who could use your help? Change rarely comes from waiting. It comes from someone deciding, today I'll start. Don't wait for someone else to bring change. Today, start your fundraiser in just minutes at GoFundMe.com. That's GoFundMe.com to start your fundraiser. GoFundMe.com. This is a commercial message brought to you by GoFundMe.
Welcome back. Glad you're able to spend some time with us here on a Wednesday afternoon. A gray day in the city and rain on the way tomorrow, but I don't think many people will be upset with that, as we're still dealing with very dry conditions. And, of course, there's still a significant number of people in HRM that are dealing with water restrictions. So hopefully we'll get enough rain to try to kind of tip the scales with regards to that as we move forward. This is the open hour. The telephone lines are open. The number is 902-405-6000 or 1-877-801-8255. There are plenty of topics to discuss today on the show. Of course, this is the open hour. You can talk about whatever it is on your mind, something you heard on the show today, maybe earlier this week, something that we didn't touch and you want to bring to our attention. Here's a perfect opportunity to do so. Some of the things that jumped off the page at me today was the Premier telling everybody, Nova Scotians don't need to worry about that deficit. Come on. It's $1.2 billion, but we're spending money on things that they want. Spending money on health care that no other government wanted to do. We're spending money on different projects to make their lives better. So, they should, I get it. It's concerning a number, but they shouldn't be too worried about that. But it worries me. And I know it worried a number of you that called us yesterday on the program. So I'm curious as to your thoughts on the Premier. Of course, the City Council yesterday voting to start the process on a bylaw that will offer Dartmouth Cove a protection like we saw on the Northwest Arm. There's some infilling that's going on there, right? And there's been a jurisdictional debate about who's responsible for what. We had a conversation about that earlier this week when we had councillors on the hot seat on the program. We watched council yesterday, at least I watched council yesterday, and was watching with interest, I will say. Is that the right way to say that? when this debate came up and council kind of danced around the issue of jurisdiction during their go-arounds when they're talking about it. Then somebody asked the question, and I do believe, I think it was Councillor Purdy that said it, but if it wasn't, I apologize. And then they went in camera and had a rather lengthy conversation, I would imagine, with the city solicitor, and then came back, defeated the motion to defer, and have now moved forward with a first reading on a bylaw that will offer those protections. I did get an email from one of the property owners, Dartmouth Cove, yesterday. It reads like this. The following is a media statement from the owners of a Dartmouth Cove property. It was the subject of an HRM council meeting. It would have been yesterday. Council chose to advance a new bylaw limiting infilling on the property. Once again, HRM Council has acted where it has no jurisdiction. Infill permitting for Halifax Harbour is under the authority of two federal departments, the Department of Fisheries and Oceans and Transport Canada. Despite being repeatedly advised by HRM's professional staff that infilling authorizations was not in HRM's jurisdiction, HRM Council chose to start the process on this, said to create a new bylaw in the working Halifax Harbour where it has no authority. The property owners, disappointed in Council's decision, it should send a chill to all private property owners that HRM Council believes it can create bylaws that effectively take private land from its owners and rezone it solely for public uses. We will consider all our options and to protect and manage our property going forward. 902-405-6000 or 1-877-801-8255. And then, of course, the gun debate has been reignited after that videotape surfaced with the public safety minister having a conversation. Said he was didn't know that he was being recorded, and it was that he spoke, or his quote, his comments were misguided. And then he went on to say, having said that, Mr. Speaker, this was on the floor of the House of Commons yesterday, it's important to have a program in place. It's what Canadians are looking for. This, after on that tape, he said a number of different things, and there's a whole laundry list of things that he said on it, but the ones that jumped off the page for me was that he didn't believe that the local police forces have the capability to enforce this buyback, and that it's, and paraphrasing, it plays well in Quebec, and that's kind of why they're doing it, and that the minister also said that this was going to be a tough day yesterday, and this was being forced on him because it was part of his mandate from the Prime Minister. There's a lot more in there. I know many of you have watched the video. I know a number of you have sent me the video, and I'm curious as to what your thoughts are on this, as we saw that the Public Safety Minister yesterday announced that this gun buyback program will be piloted in Cape Breton. And we're going to dig a little bit deeper into that a little bit further on during the week, or maybe into next week, when we'll try and speak with police force that's going to be responsible for enforcing this up in Cape Breton, and see if they really do have the money. It's going to be capped. The federal funding is going to get capped at $729 million. And without that money, that they say they're going to give us fair and equitable return on any firearms that are now outlawed under these rules, that money will get eaten up pretty quick. And then what happens? If it's capped, then do we go without? Do we not get paid for it? So many questions. Let's begin with Nicole. Nicole, how are you?
I'm well, Dan. How are you?
I am well. What's on your mind today?
I wanted to kind of piggyback on the conversations you've been having today on senior care,
sure,
and maybe offer a different lens on the conversation.
Okay.
So you were speaking, I think his name was Gary McLean earlier, and
yep,
he was talking about some of the earlier builds.
It's Gary McLeod, and he's from ACE.
Gary McLeod.
Yep.
I apologize.
Yep.
Yes. So back in the day, I used to be an interior designer, and I worked for one of the largest senior care providers in Atlantic Canada, and I worked intimately on some of the builds that happened through the Dexter government. And it was a really interesting process and very eye-opening, because at that time we were building for 2020. And so now we're looking at these reports from the Auditor General, and we're looking at the deficit that's happening in Nova Scotia. But I think the bigger question under senior care that we need to be asking ourselves is, why are we asking the government to prepare these facilities when we know that they're not really capable. They don't seem capable and competent to do it. Clearly, they're not financially responsible. So what are we asking them to do that we're not doing for ourselves? And something that I've spent the past few years doing is working with local contractors who are doing renovations for people who are maybe in their late 40s, 50s, 60s, and really taking a hard assessment and looking at their properties that they already have, the equity that they already have in their home, and going, okay, well, how long do you actually want to stay in your home? And what do we need to do to ensure that you can stay in your home? And kind of taking this experience that I have designing these facilities and actually applying them to people so that we don't have to look forward to the government to take care of us, and how we can start making those provisions to take care of ourselves long term. And there's like a much deeper kind of existential question under all of this, and I think it has to do with the role of elderly in our society and how they've kind of moved from holding a function to holding a title. And anyone who's interested in the more philosophical conversation, I highly recommend Stephen Jenkinson. He's beautiful. He starts beautiful conversations on this, on how we actually care for our elderly. But I'd be really interested to see maybe the conversation shift with people like I can't think of his name. Wilkinson, the broker that you talk to often.
Right.
What's
Wilkins.
available for
Clinton
people? Clinton Wilkins. Thank you. Like, what's actually available for people in their equity? How can they actually start looking at staying in their home as long as possible, using the equity that's there, planning earlier, working with people like myself and other experts who are well versed in aging in place, and actually not rely on the government for these facilities. Like what happens? What starts to shift in the public narrative when we start taking responsibility for that instead of offloading it onto them in the future?
That was a big topic of discussion several years ago, was that the plan was to try and keep people in their homes as long as they could, so that we didn't when there was the discussion, it might even have been during the Darrell Dexter government, this silver tsunami that was coming, right? All of these people, the boomers were retiring at the same time, and that conversation, I don't know, it kind of went away, didn't it?
It kind of did, and what happened is I think we've seen a lot of home care workers show up, but a home care worker is only as effective as the home they're working in.
Right.
So if you're putting in a home care worker in a home that doesn't have a bathroom that's equipped for someone who has mobility issues and they can't actually get around their space, or they don't have an electrical panel that's equipped to maybe put in a power lift, or they don't have the ingress or egress, they don't have ramps to be able to get in and out of their homes. Like, those are really achievable and solvable solutions. But if you have to front load that financially and only respond to it when you need it instead of prepare for it ahead of time, it becomes insurmountable for a lot of people. And then what they end up doing is selling their home, taking those proceeds to try and pay for a care facility, which is eating up the proceeds of that home much faster than you would ever pay like someone to come into your home to care for you. And so I just think that the conversation, it would, instead of just looking to the government for solutions, I think we could get really creative in our communities. We have more than enough care workers, more than enough estate brokers and mortgage brokers and lenders and people who have expertise in end of life care or caregiver support or property management. Like, we have such a wealth of knowledge in our citizenry that if we can start to bring that together and have those conversations instead of just waiting for this dysfunctional government to try and solve it, I think we have a fighting chance.
Nicole, appreciate the call.
Thanks, Dan.
902-405-6000, 1-877-801-8255. The open hour continues after the break. Boy, listening to that promo there in the commercial island about the Blue Jays looking to lock up that number one seed, I would have said maybe even earlier this week that would be, pretty easy to do, but it's proving to be very difficult. The Blue Jays, I think, have lost, 5 of 6? And that magic number remains at 4, losing again to the Red Sox at home last night. The White Sox losing to the Yankees at Yankee Stadium. So the Yankees now within one game. I think there's a person out there listening to us today that's a pretty significant Yankee fan, and we do miss you, Todd. And he was pretty happy right now about all the stuff that's going on. But my goodness, what a time to get into this slump with a playoff position clinched. We know that that's going to happen, but life would be much simpler, I think, for the Blue Jays should they lock down that number 1 seed and turn the ship around. I know they're missing Bo Bichette, but boy, it's been difficult to watch as a Blue Jays fan. And don't forget, you'll catch all that action live right here tonight on the radio station 95.7 News Radio. So I hope that you can tune in to that. The open hour continues, 902-405-6000 or 1-877-801-8255, 902-405-6000, 1-877-801-8255. Let's welcome Jill to the program. Jill, how are you?
I'm great, Dan. How are you?
I'm good. What's on your mind?
Well, I just wanted to talk quickly about Dartmouth Cove.
Sure.
And so I'm one of the founding members of the Friends of Dartmouth Cove, Save Dartmouth Cove. And we're very keenly interested in what's happening, and very excited yesterday that council actually did move ahead by not accepting the staff report, which basically said sit and wait and do nothing, and instead adopted Councillor Austin's motion to move ahead with the first reading of bylaw protection for Dartmouth Cove, which will certainly, treat it in the same fashion as the Northwest Arm.
Jill, let me ask you this question. We've talked about this a lot, right? But I'm curious your perspective on it. Why is the infilling bad? Why are people so opposed to this happening in that area?
For several reasons. For one thing, Dan, Dartmouth Cove, for whatever reason, people like to characterize it as being, it was industrial, it was used for this and that. And they are true. It was used for industrial. But the last industry really moved out of there in 2003 when the Dartmouth Marine Slips with Irving closed down. And they were actually, part of the reason they closed was they were actually putting deleterious substances into the harbor, and DFO had something to say about that, as did the residents. But anyway, fast forward, really the only industrial or commercial businesses right now, you have Dominion Diving. They use the cove. They come out with their boats and things. But all the other old industries, and we're talking going way back, molasses factories, molasses factory, chocolate factory, those have been gone for a long, long, long time. And even when they were there, the cove was not infilled. So Dartmouth Cove is fairly small. It's shallow. It has seen its fair share, I'll say unfair share of indiscriminate infilling. And what happens is because of the jurisdictional loophole that has been there on the books for years, Transport Canada and Department of Fisheries and Oceans are the two federal bodies who have had jurisdiction over infilling. So someone would just need to apply to them. Typically, no one knows what's happening. Approval's given, and bang, infill is started before anybody knows. So what's wrong in our area is that we've already had enough infilling. And the infilling that has happened in the past has been very, like the latest, is really being used right now as a junkyard storage area. It's pretty unsightly. And around Dartmouth Cove, between the streets of Canal Street and what used to be Maitland, it now has a different name that I find difficult to pronounce. Those old buildings are derelict, need to come down, and there's new development that should be happening in there, a positive development. Dartmouth Cove is surrounded by a residential area. It has the Trans-Canada Trail, which links both ferry terminals together. It is used all the time. And we also have a large apartment building component with the former Maplehurst Apartments, which are now owned by Killam. And we also, on the edge of the cove, we have the Centre for Ocean Ventures and Entrepreneurship, which some people don't really know anything about. It's where at the former Coast Guard base, and that is a jewel for the entire province, for Dartmouth, for Halifax. It is there and does extremely important marine research. There's 40 or 50 or so marine-dependent businesses that are in there. A lot of them are doing research startups. And they use the waters of Dartmouth Cove on a regular basis. In fact, their wharves, a couple of their wharves, floating wharves, have vessels that are tied up. They're smaller, but they still need to come in to navigate to get to those wharves. And if you look at the proponents, the one who's, stirred this all up, the company that you were speaking about earlier, their water lot that they are proposing to infill comes right up to where Cove's vessels are, and there's no way you can't navigate a vessel on a dime. They need an amount of area in order to navigate. And Cove has had a combination of over $40 million invested of taxpayer money from both federal and provincial bodies. We've had the daylighting continual daylighting of the Shubenacadie Canal, of the Sawmill River Creek, where you've got fresh water entering the harbor. And the idea of that is for, I believe, storm mitigation, but also, importantly, to allow the marine species to be able to travel upstream again to get into the lake system.
The fish.
The fish. We have seen a huge change in the quality of the water within Dartmouth Cove since the sewage treatment plants came online. Now, there is still untreated wastewater that enters the cove now and again, because sometimes if there's overflow or there are some times when that still goes in. And certainly this project or any infilling is not going to change that. So our cove is not very big, and I would love the people who continually say, oh, it's industrial, it's in this and that, to come down here and actually have a look. We've got a lot of marine species that are in here. There's the elvers, there's eider ducks, and there's also the eelgrass patches, which are already protected right now. They're trying to bring those back. So there's a number of reasons for this area that there should not be infilling, or certainly not indiscriminate infilling. And, the company that is wanting to do this have not been particularly community-minded. When they started this process, they had one name. The name for this project has changed over the last 3.5 years, and now they're painting it as though they are going to be the saviors of Dartmouth Cove. And frankly, it's just egregious. This notion that it's going to be eco-infilling, that it's going to save the cove, it makes no sense that by dumping basically 2.5 football fields worth of slate and other material into the cove is somehow going to make it better than the way it is now. So we're grateful that Council has reacted to the public's letters. There's a lot of movement on here. We've had many public meetings where people have come out. It is not a NIMBY thing, and it's not a, just my neighborhood. No, this trail is used by many, many, many folks who are going to work, who are using it as a park, who are using it for all kinds of ways, all kinds of reasons. And I just want to say we're just really glad that, yes, Council listened, that they rejected this industrial notion, because we want to move forward and make our city a beautiful place. I'm not against development of the area. We're against indiscriminate infilling. We're against ruining what has been saved in the cove so far. And we're glad that they finally accepted, or seem to accept, Transport Canada's continual assurances in letters saying, HRM, Transport Canada has no authority over your bylaws. You have the authority to bring in bylaws over your properties. We are only interested in things that concern navigation. And if you look at it this way, it's kind of a thing called dual compliance. So if the federal government said, yes, you can infill, because, and this is the important part, because it does not affect navigation, then if the city says, no, you can't infill, that also has no effect on navigation. It's dual compliance, it's win-win. And there seems to be some, misunderstanding about that. And the other thing is...
Very quickly, Jill, I'm almost up against the break here.
Yep. The other thing is, I'm so glad that they did not cave into the possibility of having a legal challenge, because where would our politics be if every time someone threatened a lawsuit, if they just caved? So that's my story. Thank you, Dan, for entertaining me. I appreciate it. And public meeting will be coming up where everybody can bring their comments to Council and get this moving forward. We still have a few steps to go.
Appreciate the time,
so
Jill.
much, Dan.
Have a good one.
Okay.
902-405-6000, 1-877-801-8255. We're up against the break. Open hour continues after the news.
Imagine if today was the day your idea changed someone's life. Imagine if you could help someone pay for college, help your community build a new playground, or help a child make it to that dream competition. With GoFundMe, it's all possible. GoFundMe is the world's #1 fundraising platform trusted by over 190 million people. Every week, ordinary people meet their goals and do extraordinary things. Your ideas matter. GoFundMe isn't just for emergencies. Want to raise money for your kid's soccer team or raise funds for a small business, a creative project, or event? GoFundMe helps you turn ideas into reality. And help adds up. Fundraisers you start for someone else raise up to 5 times more. So think right now, who could use your help? Change rarely comes from waiting. It comes from someone deciding, today I'll start. Don't wait for someone else to bring change. Today, start your fundraiser in just minutes at GoFundMe.com. That's GoFundMe.com to start your fundraiser. GoFundMe.com. This is a commercial message brought to you by GoFundMe.
All right, just a few minutes left in this edition of the Open Hour. A couple of lines open if you want to get on, 902-405-6000 or 1-877-801-8255. We had a conversation earlier in the day today about living spaces for and home care spaces for the elderly, and Gary joined us on the program to talk about that, and then we had Nicole join us as part of the Open Hour to offer up her suggestions, and Gary's giving us a call back from Ace to respond to those points. Gary, appreciate it.
Yes, thanks for taking my call, Dan. We've had this conversation of keeping people in their own homes many times, especially with the Dexter government. They had a plan where it was cheaper to keep people in their homes at $30 a day as opposed to keeping somebody in a nursing home for $300 a day. And I don't know how that's ever possible, Dan. That $30 a day, that's at $15 for minimum wage, that's only 2 hours. In a nursing home, you get 24/7 care. But there was also another idea that the present PC government wanted to we had this conversation with Seniors and Long-Term Care Minister Barbara Adams before she became minister about people having empty bedrooms and bringing in other people to share their home, and they would have workers coming in that would be publicly funded. It all sounded well and good, but there's also the issue of not enough care workers to travel, especially in the rural areas. And there's people that have been in that waited days to get a home care worker in to visit their home. So there's a problem about staffing with these things, and the idea about using your home equity to renovate your home, to keep yourself in home. Well, there've been examples, and I know a few personally, and one that really stands out was a gentleman that spent $30,000 to renovate his home to keep him in his home, and he wound up in a nursing home 3 months later, and it was good for the workers. It creates lots of work, but there's very little benefit in the long run to keep people in their own homes. These are just I can't stress enough that it's a new utopian idea to keep people in their own homes, but at some point they're going to have to go to a long-term care facility. If they live long enough, they become to a high level of care that they have to go to a nursing home. So it's a grandiose idea. I like the idea, but it's not feasible. Dan.
Wouldn't those workers, Gary, and please correct me if I'm wrong, but you said there's an issue with home care workers, and that's been well documented. But wouldn't we, if we're going to build these 5,800 beds or whatever that number is now, wouldn't we need workers to service those beds anyway?
Well, yeah, but I mean, if you can get these facilities built, and the government has a plan to staff them all, I think that it's just as easy, like I said, 24/7 care, as opposed to people spending their own money for a short-term gain that's not feasible either, Dan. I think, like I say, it's good for people to put forth these ideas.
Right.
But I'm a little cynical, and Dan, I got to tell you that it would create a lot of work. And can you imagine, like the $30,000 renovation that I just spoke about? That was about 20 years ago. That $30,000 today would, the cost of building
for sure.
materials.
Everything's expensive. Gary,
it would be outlandish.
Let me ask you this question. Speaking from experience with family members who have transitioned into long-term care and so on and so forth, I don't know many of them that didn't want to stay in their home as long as they possibly could.
Oh yeah, that's quite true. I would have loved to have kept my mom home as long as I could, but it was impossible. I mean, especially when I was still working, I had children that, well, they were getting young adults, but they still needed my help because they were going to university and such. But it's just so much on a person to the caregivers. I've known very wealthy people that kept their loved one at home, and at the end of it, they just couldn't do it anymore. And there was even in the Chronicle Herald stories about how this one gentleman, he had all kinds of money, and after his wife went to the nursing home, he said, "We need more nursing homes," because he just felt so relieved that finally somebody was going to take care of his wife. And even though he had money to bring people in, he was still there 24/7, where the workers weren't. So, I can give you all kinds of reasons why it doesn't work. It works to a point. As long as people are a bit cognitive, but if they need to be lifted in and out of bed and we're going to a washroom, Dan, in Nova Scotia, it's the elderly looking after the elderly, and it's been well documented that around 62% of the caregiver will die before the person that they're caring for. And it's all because of, these grandiose ideas, keep them in their own home. You think that your children are going to look after you. There's been just another report that came out, I think it was CTV or one of them, that said don't rely on your children to take care of you because in most cases it doesn't happen. And it won't happen. And the only thing that I can see is better nursing homes, better staffed, with quality care. They do it in Europe, and we can do it here.
Gary, appreciate the call, sir.
Thank you, Dan. Take care.
902-405-6000, 1-877-801-8255. Gary making some statements there. And again, I go back to just my experience. In my family, when people were getting to the point where needed assisted living and transitioning into longer term care and so on and so forth, and it was the person that was going through it that didn't want to go and wanted to stay in their home and had the means to do so. And I understand the labor issues, Gary, I really do, and I know that it's well documented, right? But just building long-term care bed after long-term care bed is going to be great for those that you talk to us about and so on and so forth. But is it really is it going to solve the problem that we have? Right? It's an interesting debate. A couple of emails quickly before we take off for the day today. I mentioned earlier that, and I'm surprised I didn't take more calls on this than I did. When we had our long debate yesterday about the provincial deficit now at $1.2 billion, and the Premier cornered by reporters yesterday after question period and was asked, if Nova Scotians should be concerned about that number. And he's like, no, don't be concerned. You should be happy your government is looking at advancing healthcare, spending on healthcare, yada, 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 right? I don't know about you, but I'm certainly concerned about it. And I'm certainly concerned about the $800 and change that I have to spend every year just to pay off the debt, right? Before you build a long-term care bed or you hire a home care worker or a doctor or fix the highway or build a hospital or build a school or hire a teacher. Right? Anyway, Mark agrees with me. Mark writes, Mr. Houston's remarks on the provincial debt are shocking. I wonder if he runs his own personal finances like he does our province. Kicking that can down the road and having our kids in debt up to their eyeballs is irresponsible. He writes, start acting like Premier, Mr. Houston. And my rants apparently about Windows 11 not going unheard. I got an email from Dave who said, yeah, Dan, I agree. I shouldn't force an upgrade. Windows 7 was my favorite version. Well, I can even go back further than 7 because I've been doing this for a while. I understand the need for it. I really do. I know we can't just say, this is the way we've always done it. It works. Don't mess with it. It ain't broke, don't fix it. Right? I get it. There's different pressures on particularly on computer gear. Right? There's different ways that we have security problems and so on and so forth. I find sometimes though that the two big companies that control the personal computer markets in this world, right, force upgrades and updates just because it makes them money, right? Look at your phone. Vanessa's smiling. Vanessa got a new phone. She's pretty happy about it. And she got 2 of them now. So, but you get what I'm getting at, right? It just feels like that sometimes these upgrades get as our previous writer wrote, kicked down the can down the road, just so we have to end up buying them. Anyway, appreciate you all for picking up the phone, dialing the numbers, and joining the conversation. I truly appreciate it. Thank you to all of our guests who joined the show today to impart their knowledge upon us. It'd be a pretty boring 3 hours if it was just me yammering on all day. We have a busy show planned for you tomorrow. We have a busy show planned every day, but tomorrow is the Thursday edition of the program. We're going to dig into a little bit more into Dartmouth Cove. The councillor responsible for the motion last night, District 5, Sam Austin, will be our guest. We're going to dig into the controversy in Ottawa with the gun buyback program and the comments made by the public safety minister with our good friend and political scientist, Laurie Turnbull. And we're also going to take a look at the brand new firefighter training plan in Nova Scotia with the minister responsible for that. Thank you to Vanessa Vananez on the other side of the glass for doing what she does every day. And until then, everybody, please be well and be kind to one another. Welcome back, and the reason I'm laughing, I talked about this off the top of the show today, is and if you missed it, we're getting upgraded here at the radio station, right? We're getting, apparently, somebody told me that we're lagging because this Windows 11's been around for a while, and we're just getting to it as it's the end of the service life of Windows 10. But the thing is, it happened to my computer yesterday. So today is the first show that I've had with all these changes, and everything looks different and it's in different spots. And I know it's it's minor on the grand scheme of things when it comes to problems in the world, but right? I will never understand. Well, I think I know the financials behind it, but I will never understand why we have to continually upgrade and update things, because didn't the old ways work good? Just saying. I'm done ranting. Let's welcome Chris to the show. Chris, how are you?
Good afternoon. I'm fine. How are you, Dan?
I didn't hear your voice on Monday. I was a little concerned.
Well, my nemesis wasn't on there. And it wasn't... I didn't want to... upset the apple cart any more than it got upset. You had plenty on the go on Monday without me.
It was busy. It was a vigorous show, I've been calling it. It was vigorous.
It was a vigorous. It was great. You need more of them.
Okay.
I love a good argument.
What's on your mind today, Chris?
Well, I listened to you earlier when you were mentioning about the borrowing HRM Council is supposedly committed to over the next few years.
Right.
What did you say, $1.6 billion or something?
Yeah, over 4 years, I think it is. Debt financing.
Yeah, over 4 years. And, I mean, a 10% tax increase.
Well, that was I don't know if that was supposed to come out at council. I don't know if you saw it, but the mayor said it, and that he had a briefing with the CFO, and that, you kind of give councillors a head up on that's what they're looking at before the budget process begins. So that one, I don't know if he was supposed to say that or not, but it certainly came out at the meeting last night.
Well, it might have been strategically
could have very well been
as such to give us a heads up so that, one, either we have enough time to maybe head it off at the pass, so to speak, or what politicians always like you to do is to forget about that, because so much time changes between the announcement and the actual fruition, and something else comes bouncing across the stage to take your attention away from it. And at the time when they're actually deliberating budget, maybe we'll forget we heard this back 6 months ago. But this, I don't know, Dan. I know I've said this before and I sound like a friggin' broken record, but man, we've got to do something with this council. They have got to go one way or the other. They've got to go. This spending is unbelievable. A potential 10% increase on the taxes, 37% on water, Nova Scotia Power, etc. It goes on and on and on. You tell me one person, I don't care if they're a union person or private employee or whatever, I don't know anybody that's got wage increases coming up over the next few years to keep up with this stuff. I certainly don't. Do you, Dan?
Absolutely not.
I mean, I don't know if people realize what a serious state we're in here, but you take a 10% increase, and then what's it going to be the year after that and the year after that? I can see 4 or 5 years down the road, our taxes with those kind of increases, we'd be paying double the amount of taxes. I can't afford double the I can barely afford the taxes I'm paying now, for God's sake.
I hear you.
I mean, this is unbelievable, but we've got to do something. My suggestion is very simple, council members. If any of you are listening out there, stop the unnecessary spending. Just stop spending. I mean, this is ridiculous. The Forum, talk of a stadium, the electric buses and the related infrastructure for that, electric ferries, all this kind of stuff. Nice to haves, but we don't need that stuff. We need basic services, and we can't afford to keep paying for all this fluff and all this extra stuff that some people think is needed. The council certainly seems to think is needed, but it's not. Ask the taxpayer. Have a plebiscite on some of these things. I mean, I know it costs money to do that, and maybe you wouldn't get as much participation as you'd like, but at least you get you take a temperature of the bathwater as such. And I think you'll find out that the majority of people don't want this. But I got a letter in the mail from HRM on their proposed Halifax Urban Greenway Extension and Active Transportation Connection.
I did see something on that today. I didn't have a chance to read it yet.
In other words, a long, wordy way of saying bike lanes. Come on, guys, bike lanes, that's all it is. And they're going to have 3 information sessions, engagement sessions, they call it. Mm-hmm. Well, the first one, October 2nd, is a great time on a Thursday between 1 p.m. and 4 p.m., just when everybody's going to take the afternoon off work to go to one of these things. They always do this. They have these information sessions. Now, does that mean, it doesn't say anything that would be allowed for presentations or not, but they always seem to have it during a weekday when you're working, and most people can't get away to go to one of these things. Have it on weekends and the evenings when people who want to go don't have to give up their work in order to go, so you get some kind of response to this thing.
Right,
this is
Chris,
unbelievable.
But what I will say is that if you read further down, there's a second one on a Saturday at 10 in the morning at Point Pleasant Park, and then a Thursday evening from 4:30 until 8 at the Dauphiny
Center. You're right, Dan. I'm looking at that. You're in tune with what's going on.
See,
aren't you?
I try to be in touch.
Yeah, no, you're engaged. There's no question about that.
That's right. I'm paying attention. I just listen to Rick Howe.
Paying attention. Yeah, that's right. Are you outraged?
Always, every single day. Chris, hey, I appreciate the call, sir.
Okay, thank you.
902-405-6000, 1-877-801-8255. In case you're wondering what the heck Chris and I were talking about, the HRM has put out a release today, and apparently it's being mailed out, that they're going to have some feedback sessions on what's the Urban Greenway Extension. HRM inviting residents to learn more about the Halifax Urban Greenway Extension and active transportation connections to Point Pleasant Park, right? The residents are encouraged to learn more and do a survey that's available on the website. The sessions are Thursday, the 2nd of October, as Chris told us, at St. Mary's University from 1 till 4. Saturday, the 4th of October, from 10 in the morning until 1 at Point Pleasant Park near the Tower Street parking lot. Thursday, October the 9th, that's going to happen from 4:30 until 8 o'clock and those sessions will happen at the Dauphiny Centre on Tower Road at St. Mary's University. So if you have some concerns about the urban greenway, and Chris is right, part of that active transportation links are bike lanes, there's your opportunity to voice your opinions and concerns with HRM. We're going to take another break, and the open hour will continue on the other side of it. You're listening to the Todd Veinotte Show. I'm Dan Alstrand. We are back in minutes.